The interesting thing is that, I've been in the industry for a long time, 25 years, and had talked a lot about patient-centered care. It had emerged as a priority and kind of a rallying cry for the industry long before I had my first-hand experience at what it meant. My daughter, one of my daughters, had a hernia repair operation when she was 6 years old, and it's a very common procedure, definitely not a high-risk procedure, but nervous-making nonetheless when your daughter is going to have surgery. Everything went great, right? Go to the hospital, treated very well. The caregivers were talking to me, they were talking to my daughter. They definitely understood that we came as a package, right? And one of the things that was a remarkable part of the experience, although tough for me, I have to say, is I was allowed to go into the operating room and hold her hand as they put her under the anesthesia. And we were walking toward the operating room, and my daughter began to shake. She was scared. And we had talked a lot about this surgery, and I tried to make her feel comfortable and answer her questions, and she started to shake, and she looked at me, and her eyes were filled with tears, and she said, "I'm scared." And I said, I'm not surprised you're scared, but you're going to be great. You're going to be fine. These people are going to take great care of you. We walked in there. I held her hand as she was going under, watching her eyes roll back in her head. I can't tell you as a parent how that made me feel. And her fear created fear in me. It created anxiety in me because, I'm there for her, right? And there wasn't much I could do to allay her anxiety. Anyway, so she goes under. I leave the operating room. I go to the waiting room. I sit down. I call my husband. I call my mom. Tell them, I was a little shaken. I was a little teary. I reached forward, grabbed a magazine, which of course I wasn't going to be able to read, but I opened it up. And next thing I know, the surgeon's standing right next to me. It hasn't even been 15 minutes, and he's right there. And he says, so everything went great. She'll be moved to recovery in just a couple of minutes. And I looked at him, I said, wow, that was fast. And he said, well, we get paid by the job, not by the hour. What? You get paid by the job, not by the hour? My inability to talk about it right now is really a mirror image of how I felt at that moment. I couldn't believe he said that. So many thoughts went through my head. These are not the words of someone who practices patient-centered care. Definitely not. And in that quick moment, that off-the-cuff remark he made, my trust was completely dissolved. And it was a moment when he could have alleviated my suffering, right? Because I was suffering, and my daughter was suffering too, and we had this sort of trust thing going on that was helping to mitigate the suffering, but he completely undid it. He completely undid it by this manifestation of how he felt about my daughter, a job, and about, how we fit into the equation. So that's when I realized what patient-centered care really was and how it should be practiced versus how it often was practiced. And to contribute as an organization to shifting those attitudes and really reestablishing that trust between patients and their caregivers and their families and the system it's a great opportunity for us.